Good afternoon. My name is Dr. Anthony Cavazos. Welcome to DRC 360. Today I'll be speaking about IV therapy. It's a very exciting part of integrative care. I'm a board certified family doctor as well as board certified by the A4M or the American Academy of Anti-Aging and Regenerative Medicine. So we are on hopefully the cusp of new therapies to really optimize people's wellness. And as we all know, this day and age, it isn't always you are what you eat. It is you are what you absorb. And why I say that is because many people have various symptoms such as fatigue, brain fog, skin rashes, insomnia, bloating, things that shouldn't be happening to them because they're eating clean or they feel that they're eating well. But they go to their primary, they get a panel of blood chemistries that are essentially a CBC, CMP, and what comes back is, well, you're normal. Your vitamins look good, everything's normal, Mrs. Jones. And so Mrs. Jones goes home and says, gosh, I just can't get going. Something isn't right. My hair's thinning. I feel my fingertips are cool. Something isn't right, but you just keep going because that's what we do as human beings. We're busy, we're parents, we're students, we're workers, and we just have to keep going on to the next day. But I think there's a solution, and that's what I'm here to talk to you about today. Cut. All right, let me see here.
When you're ready
Okay.
to start again,
Yeah.
I'm going to count you in each time.
All right.
Okay, the reason I do this, not for you, it's for me, so I know where I need to come back in. Okay? All right, so, and 3, 2, 1.
Many of the problems today are that we have pollution, we have toxins, we don't even know our food source very well. Many people criticize the GMOs, but the fact of the matter is unless you're growing your own food in your own soil and understand what that is about, we are probably only absorbing 50 to 60% of what we eat. Some studies say the best we absorb is even lower than that. Some criticize that it's only about 10%. Part of this is age. Sometimes it's the time of day that we're ingesting food. It's how it's prepared. We know that cooking certain vegetables leaches certain vitamins. Juicing is very popular today. And while that's a nice way to grab vitamins from multiple sources in a drink, it's actually leaching the pulp and fiber out. And we know that the average American diet gets about 5 to 6 grams of fiber a day when you're supposed to get 35 grams. This is very essential for better gut health and immune chemistry. Another problem is genetics. Many people, in fact, about 15% of the population has the MTHFR mutation, which is the methyl tetrahydrofolate reductase deficiency. So they are unable to methylate folic acid, which then causes them to become more toxic. They cannot detox. They build up homocysteine, which is a bad inflammatory player. Other things that also are at play are cut. Sorry. Let's see here. Oh man, so yeah.
Ready?
Yeah.
3, 2, 1.
In addition to the MTHFR mutation, we also have to think about medications. Many people take statin drugs, and while you're apparently lowering your cholesterol, statin drugs are notorious for leaching CoQ10. CoQ10 is both a fat-soluble and water-soluble vitamin. It's a great antioxidant. It clears out coronary arteries, but you're depleting yourself of this when you take a statin drug. I see many women who are fatigued, who have brain fog, who have thinning hair, and they're on birth control pills. And unless you study this closely, you wouldn't know that birth control pills, mainly from the estrogen component, leach B5, B6, B12, folic acid, magnesium, and especially zinc. And zinc is so important and vital for thyroid function. So as we think about nutrition, we need to think about stages of adequacy. There was a famous experiment done in 1964 by a Dr. Myron Bryn at SUNY in Syracuse, just up the road, and he basically starved his patients, which I guess back then you could do. Now it might be a little bit tougher to get volunteers for this. But over a 10-day period, he was able to totally cause symptomatic problems with thiamine. And so he depleted these people of thiamine, which is important for neurological health. So people were becoming acutely confused, and their reflexes were absent from the knees down. Very serious issues. And here we think we're all okay. We get our 3 square meals and we're good to go. When in fact we may be on that cusp of a serious deficiency. So when we think of deficiencies, again, think of first of all adequacy, and then think of a negative balance as the next stage. After that, you're really talking about symptomatic issues, and that's probably the issue here where most of us are missing something. We're not tuned into the patient when they're in that negative balance. We're waiting till they get to feeling like their nails are brittle, they're constipated, they're lightheaded. That's too late in the game. By that time, the person might need a blood transfusion. One of the other issues about IV therapy that I think is very, very fascinating is that we can really reboot one's chemistry, and this is where I think it's a game changer. We've been told to give people injections for antibiotics to work faster. We give injections for vaccinations. We know that antibodies are working in a few days, if not a few weeks. So why not push this even further intravenously? When you give something intravenously, you're actually able to give supradoses to then push the chemistry from the kind of serum into the cell, and that's where all the activity is happening. So it's kind of at that mitochondrial cellular level that we have to start thinking differently, and that will help us manage our patients better. One of the most common deficiencies that is worldwide is iron deficiency. About 5 billion people have suffered this, and about 2 billion are anemic. Iodine is another very common deficiency in the world. 2 billion people suffer it. Goiter, mental retardation, some serious issues. Vitamin D, we're hearing a lot about this in the last probably 5 to 10 years, mainly because of people aging, the baby boomers getting older, and concerned they don't want to get osteoporosis. Calcium is another deficiency, but that's kind of gotten some bad press because of potential plaque buildup in the coronary arteries. Going back to D, there was a recent study that said you needed to be between 60 and 80. And again, this is where, when you look at LabCorp, Quest, any lab out there, they're going to say 30 nanograms per milliliter to 100 nanograms per milliliter is normal. Well, that's not true. 30, 40, 50 is too low. And you have to understand this. You have to be 60 to 80. So I recommend 10,000 units to most patients. And in fact, there's never been a single death from overdose. A lot of people say, well, it's a fat-soluble vitamin. Dr. C, I'm worried about toxicity. There was a study that showed that some dogs actually that took too much D had hypercalcinosis and ended up, I think, perishing because of a basically uropathy and getting uremic. But when you looked at that, the LD50, so you would have to have taken the equivalent of 3,500 10,000 IU capsules of D a day to reach that LD50, that lethal dose. So it's never going to happen. When you go out in the sun, the UVB light, and you don't wear sunscreen on your arms and your chest, you can generate about 20,000 IUs of D3 in probably 25 minutes. So, Mother Nature's smarter than we are, I think, in many ways. Cut. I need some water. Let me just grab some water. Thanks. Mouth is getting pasty. Is this water? Huh, we got the. This is good. I just need a little.
I made tea. Like this.
Oh. I gotta give a talk here. I'm in the midst of. Okay, thanks. All right, let me see where I am. Okay. Okay.
All right, just make sure that we're staying focused here. Okay, look right at the camera.
Can't remember where I last. And I think I was talking about D.
3, 2, 1.
And also for D, to have a proper absorption, you need vitamin K2. This is very important. So you need about 100 milligrams of K2 to maximize absorption of the D3. So remember to look for products that have a K2 combination with the D. That's for primary best absorption. Our patients are complicated. Our patients are on the go. They want quick answers. They want kind of fast solutions. And I think one of the things that integrative practitioners have realized is that there are no kind of quick and easy, dirty answers. We have to set realistic expectations, and on the other hand, offer something that is unique. And one of the things that I've found very helpful in establishing my IV protocols is working with a lab called SpectraCell. They're out of Houston, Texas. It's 2 vials of blood. They do deal with third-party insurers. So if your patient has insurance, it's $190. If they don't have insurance, it's $290, and that's as important to let your patients know ahead of time. But what you get back is a report about 10 pages long that actually will graph out where their lymphocytic cellular levels of A through Z is, literally. So vitamin A through zinc. So you get all the Bs, you get many amino acids, you get many antioxidants, including glutathione, which we'll talk about later. And as an example, I'm just going to hold up a report here, and then it'll be posted in your handout. But what is fascinating about this is it's not the serum levels of D3 or B12, and it's looking at cellular levels. So this is the only lab I know, and I've researched this for the last 10 years, that really does this type of testing. And I would highly recommend it because it's the blueprint then of what your patient is cellularly depleted in, and then you can really tailor their therapy for that. So SpectraCell out of Houston, you would need to set up a relationship with them, but it's a very, very helpful test. And since lymphocytes have about a 90 to 120 day turnover, you can rest assured that you can tell the patient, well, just because you kind of didn't have a good week or 2 weeks of, dieting properly or taking your vitamins, it doesn't matter. This is the last 90 to 120 days of what's been going on cellularly, kind of like a hemoglobin A1C for diabetics. And also, therefore, you wouldn't want to repeat this every 3 or 4 or probably 6 months, probably 9 to 12 months after you've done a certain protocol, would you want to redo it. So what do you need to get started to do IV therapies? Well, first of all, you need patience, right? I don't typically infuse IVs in anybody less than 12 years of age. Again, pediatrics, it is trickier. You have different dosing schemes, and I think that for most of us, even though I'm boarded in family medicine, most of my patients are adults. Also, anybody who's in renal failure or has a G6PD deficiency, do I have to test everybody who comes through the door first before giving them an IV? Not necessarily. If I get a call from a college student who just, kind of drank a little too much alcohol the night before and has a hangover, I don't think I'm going to be worried about, their renal function, unless they tell me they have, on the intake, they have kidney disease. Then that's a different story. But in general, most people know they have Mediterranean anemia. It's more common in men. They would have known when they were teenagers that, oh gosh, doc, I do have this funny anemia. I've never had to have a transfusion. And the risk here is if you give too much of an oxidative load, meaning vitamin C and something of that nature, you could cause hemolysis, which we don't want to do. So you want to, avoid those patients. Also, somebody who's pregnant, while I have given IVs to pregnant patients, I've done it only with the blessing of their obstetrician. Obviously, you want them to be aware of it. It kind of makes sense. Many women who are pregnant don't eat well because they're having their hormonal shifts and of sorts, and they're not eating well. So if you gave them B12 and B5 and B6 in an IV, it could be, in a liter of lactated Ringer's or normal saline, it could be very, very helpful. So, besides needing patience, you obviously need to think about a space or a designated room. I recommend a designated room. We're in the midst of one currently at my facility. It's fairly open. We'll talk a little bit about an area for nurses to be able to see the patients. Obviously, you're giving high doses of different medications, and you need to be aware that they can cause, sometimes, for instance, magnesium infusing too quickly can cause hypotension. So you need to be, the patients need to be viewable, so to speak. You also would want to have a bathroom nearby. Obviously, after a patient receives a liter fluid, they often have to empty their bladder. We also ask them to empty their bladder beforehand. So you want to have, these are kind of common sense things, but if you don't think about it and plan it out right, it could become quite cumbersome. Hey, you got to go down the hall and you got to go here, and person's grabbing their IV pole and things are, dripping, and it's just, you don't want it to be a messy place. You want it to be clean, crisp. You want it to deliver what you said it's going to deliver, and everybody, goes home feeling great and happy with the experience. You do need to have a prep area that has a sink, that has a refrigerator, that's lockable preferably. Yes, you're not having serious hormones or other medicines in the fridge, but you have a lot of material that it needs to be refrigerated, like vitamin C, the different Bs, and you want to do it in the right way. You need to obviously, when you get this set up, you have to also have a trained nurse. If you don't have a trained nurse delivering the IV, then the onus is always going to be on you. When I first started, I was the MD and the RN and the OSHA person all put together. But as I've grown, I've been able to now afford an RN to be present. We have compliance people that make sure, you know, we're doing everything properly, and we go, of course, to the different training sessions. So you need to make sure, you know, you're HIPAA compliant. I'm going to send you in another caption a consent form. That's super important. You have to have that. You need to have somebody who's really taking the lead on ordering your vitamins, who's really championing all of that. Last but not least, you have to think of the worst case scenario. Knock on wood, I've never had an allergic reaction happen at 360, but probably sooner or later it will. And we have EpiPens here, we have oxygen, we have Benadryl, we have Depomedrol, we have, you know, all the rescue things you need. We even have Lasix. I don't use hypotonic solutions. I use isotonic. So the chances of somebody, you know, going into heart failure here are extremely, extremely rare. And of course, when you screen your patients and you know them well enough, you may, you know, slow the rate down. You may even use a 500 or a 250 ml bag instead of a liter bag. So let's talk more about the room. You want it to be of a warm nature. You want the color to be warm. You want it to be somewhat open. I'm lucky I have 2 windows in here in this IV suite. We have 2 wonderfully very cleanable but crisp recliner chairs that are electrically operable. We have, of course, Wi-Fi. This room has its own temperature control, which is important. Usually an IV room needs to be 68, 69, a few degrees chillier. We found that that's just when you're delivering IVs, even though they've been in the fridge, some people feel flushed. Magnesium can do this. Other combinations can make the person kind of, like I said, generate heat almost. And they're like, ooh, I'm feeling too hot. And then you don't want them to kind of have a wave of any kind of nausea or dis-ease. You want them to feel comfortable. And actually, if you keep it on the cooler side, you can always add heat. We have blankets. We have a little space heater that if people, you know, want to kind of snuggle up, they can do that. One thing I will note, we also have water available and some protein bars. We want to make sure the people eat before they get here. We want to make sure they drink and hydrate. We kind of go through a first-time IV do's and don'ts. We don't want you to fast. We don't want you to do vigorous exercise right before you come in here and be all sweaty. And, you know, basically what happens is these people come in vasoconstricted, and then accessing a vein is extremely difficult. We also ask that they don't consider this as if it's a meal replacement. You still need to leave and kind of take it easy. Probably the best, if you were a really obsessive exerciser and you wanted to do an IV, the best way to handle that would be to say, look, miss or sir, do your routine in the morning, wait till the late afternoon, hydrate, eat, come in, get your IV, and then the rest of the evening, just kind of, you know, take it easy. Some people, again, they're on such a pace of life, they come in and then they leave and, you know, I'm not feeling that good now. And some of the IVs that when we're, if you will, detoxing, especially with alpha lipoic acid, we'll talk about a little later, also with vitamin C, they're not meant to feel stupendous right off the get-go. You might have to, you know, basically educate them that, you know what, you may have a day or two here where things are going to feel a little iffy. You're going to have a little maybe joint discomfort or a little headache, but keep hydrated, keep with it, and you're going to then reap the benefits. So that's very important. Also, you want to tell people if they are bringing in their cell phone, please, just like if you're on a public bus or transportation, you want them to really keep the cell phone usage to a minimal. If I have 2 strangers in here, I absolutely would ask the other one to please respect the other person's space and not, you know, be yelling on their cell phone, because this is a place and a time where people want to try to relax. and hopefully that'll teach that person also to maybe do a little, you know, quiet time of sorts, or kind of take a deep breath and meditate type of thing. What else kind of mechanically do you need? Well, you need IV poles. We have a couple right here. I love Mayo trays because I think they kind of are crisp and clean, and you know, we have angiocasts. We have, and I use 22s primarily, but you need 24s as well for people that do have very fragile veins. You want to have a little, you know, squeeze ball. Coban is important. We have some transparent dressing. That's a very nice way to keep everything sterile. So after you insert the catheter or your nurse inserts it, you have this clear, transparent dressing. You can make sure everything is sterile and crisp. And again, been doing this almost 10 years and have not had any phlebitis, thank God, or any type of serious issues. Of course, you're going to get the person who bruises. That's pretty standard. One of the most common problems is actually starting the IV. And what can happen is you can infiltrate. You get redness, you get swelling. What you may want to do immediately is stop the IV and try to reposition it. If you can't reposition it, I would say you want to immediately take it out, take the catheter out, hold a little pressure, gently massage, and then get an ice pack on it. That'll decrease any edema immediately. It's almost as if, you know, you have a strain or sprain of the vein. Think of it in those terms. So you want to ice it, elevate a little bit. And then if the patient is willing, you can try another site. Many patients, you know, they want to get their IV in, and the most I would do personally is probably 3 sticks, if you will. And after the 3rd stick, you know, there's probably an issue. The person, again, is dehydrated. Maybe they're on a new medication that is causing some issues. You know, sometimes it's not your day or the nurse's day, and you just, it's frustrating. But it's better that you let them, you know, go with then rescheduling than, you know, continuing to kind of abuse them in a bit and then continue to fail. That's not going to bode well. You also need to have a great relationship with a compound pharmacist. This is extremely important. And you want to pick more than one compound pharmacy. I use Wellness primarily. They're out of Alabama. I can give you their contact information. I also have used Wells Pharmacy in Ocala, and also US Compounding. So these are my go-to compounders, but again, Wellness is the primary one. But what I like about that is, you know, I know that person, I've visited their site, I know it, I trust their product. They are, there was, many years ago, there was a scare, I believe it was in the Boston area, where a compounding pharmacy that was making steroid, I don't know if it was Depomedrol or Kenalog, but it was some pain specialists were doing epidural steroid injections, and unbeknownst to them, the product was tainted, was contaminated with fungus, and several people passed away, and many others had fungal meningitis and just horrific side effects. And since then, you know, the scrutiny from the government for these compounding pharmacies has really risen. But Wellness and the other ones I mentioned, they've already taken steps well before this horrible incident happened several years back. They've already heightened their level of guidelines and precautions, and, you know, closed systems and double venting and whatever else they felt they had to do to be completely sterile. So their products I've been very happy with. But again, you want to have more than one, because if somebody's out of something that you need, then you have to call your backup. What is also very important, as I said earlier, you want to have one person primarily who's ordering, who's logging all of your expiration dates on your vitamins. You also need somebody who you trust that when they mix the bag, they're mixing it properly. And I would always at first, just hover over that person, and make sure they're doing it like I would do it. So you have to emphasize sterile technique. I like to use preservative free. So that's kind of a one and done. I use 1 cc vials of dexpantothenate and pyridoxine. Many of my compatriots, they use multi-dose vials that have preservative in it. But I like stuff to just be one-time usage, put it in the bag, that one time goes with that patient, and it's done. I don't worry that there's some left over and I'm going to use it for another person, and oh God, did they forget to wipe off the rubber stopper with alcohol, and could there be some cross-contamination? I don't have to worry about that. So I like single-use, preservative-free best. That's and it costs a little more, but I think it's worth it. And your patients, you can pass some of that on to your patients. I believe that's fair. For you get what you pay for, and we'll talk about pricing, because I think that's another important part of this whole talk. Is if you can offer something awesome and it increases your bottom line, then it's a win-win. So you need a person then that's gonna mix it properly, label the bag, and make sure the person's gonna come in. You don't want some of this stuff after 2 hours, it's mixed in the bag, it loses its potency, and then you would be at a loss. What are the most common solutions? I like isotonic. Those are isoosmotic. So we don't want fluid shifting into the cell or fluid being grabbed out of a cell. If you have a hypotonic solution, such as D5 normal saline, what can happen is, and there's a slide about osmolarity later that you can refer to, is it can actually cause hemolysis because you're grabbing fluid out of the red blood cells. This is very bad, and I've never used that type of fluid. And on the other hand, if you use hypertonic solution, again, what could happen is you could cause third spacing or heart failure or edema in one's legs. And again, that's not really what you want to do when you're doing an elective IV. So isotonic are D5W, lactated ringers, and 0.9 normal saline. So those would be the solutions I would go to. They've been hard to find at times, and part of this, when Puerto Rico was hit with their horrible hurricane recently, Baxter, which was a huge company that supplied Hospira and others, they were down, they were gone. And I think it can be challenging to find IV fluid bags, but you just got to be persistent. If you need help with that, I can do my best to refer you to some people. But McKesson is kind of your standard starting point. Maybe Dr. Soni has some connections as well. He's very good understanding suppliers, and I would ask maybe for his help as well. Cut.
Okay,
Okay, let me just take a drink here.
no problem.
All right, we're almost done. Yeah. How do I make this bigger? Okay. Oh, there we go. All right, let me just finish that. What did I just finish on? Oh, okay. IV isotonic. Okay.
3, 2, 1.
So what do you put in the isotonic solution or IV bag? Well, a doctor back in the 50s and 60s out of Baltimore, Dr. Myers, he treated a plethora of conditions, everything from asthma, allergies, migraines, chronic back pain, with a cocktail. And that's actually persisted to today. Actually, his cure rate was about 60% for migraines. And I think I read recently where the American Academy of Neurology said that they only have about a 45% cure rate using, big pharma drugs. So, he was even better than now what is, 60, 70 years later in terms of his treatment protocols for migraines. So what is included in a Myers cocktail? Typically you include thiamine B1, that's 100 milligrams. Typically you include B5, that's dexpanthenate or pantothenate. That's usually 250 milligrams. You also include B6 or pyridoxine, that's 100 milligrams. He included cobalamin. Now I love methylcobalamin because if somebody has the MTHFR mutation, they will not assimilate cyanocobalamin. They will assimilate and use methylcobalamin. So he usually used 1,000 micrograms or 1 milligram. I like to put in 2,500 micrograms. I think that gives a little extra jolt in it. He also included magnesium, about anywhere between 500 and 1,000 milligrams. Again, you have to be careful. If somebody comes in with a blood pressure of 90/60, I would just give them 500. I would not push it any more than that. He also included calcium, and he would range around 400 to 500 milligrams of calcium. And then a little ascorbic acid, sometimes as low as only a gram, and maximum 10 grams. So those were kind of the chief components of the Myers cocktail. What do I treat with that? Typically adrenal fatigue. So people coming in, a Myers cocktail is just a very gentle, good overall workhorse that you can expect to have people feel, I feel a sense of wellness. I feel a little more energy. My joints don't ache as much. It's good for people that are not needing to detox. The people that, if they're on a lot of meds and they're just kind of out of shape and tired, fatigued, and you're waiting for your blood work to come back, maybe you can say, look, we could start a little Myers cocktail on you. And it would at worst be neutral, and at best it would really help them out. And you're laying a foundation now of the Bs and the magnesium, things that you probably already know that they're depleted in. So I like it kind of as a general IV mix, and then I kind of tailor and taper from there. Certainly, I have successfully treated many people with seasonal allergies using a modified Myers. I do like it with headaches and migraines. But then once you start getting into people with more chronic autoimmune issues such as Hashimoto's, thyroiditis, or people with MS, unfortunately, people with other more serious autoimmune issues, then you're talking, you need a different protocol. The Myers is not really going to touch those very well. When you emphasize magnesium in the IV, you can think of you're going to help IBS, you're going to help people with muscle cramps, people with coronary artery disease, you're going to help as well. When you emphasize vitamin C, those are the ones that I'm thinking more for Lyme, people with other treatable diseases, even people, young women with HPV. We've been able to see reverses when they've done a series of 4 to 6 C drips that they go back to their gynecologist, and after about 6 months they'll repeat a pap smear and the HPV is gone. So it really, again, is changing that internal chemistry. when you have C at less than 25 grams, you're in a non-oxidative state. When you go above 25 grams, you're actually pushing the envelope, and that's where people won't feel as good the day of the IV. So we need to talk more about this in future discussions when we talk about some more serious IV protocols. Today's talk, again, I wanted to introduce the topic, and I hope this interests many, many people and we can build upon it. The other two other great ingredients are alpha-lipoic acid. This is wonderful for liver detox. Alpha-lipoic also helps the pancreas and liver speak to one another, so it's really good for weight loss. I've done 300 milligrams up to 600 milligrams in some patients, and they've lost 2 to 3 pounds a week, and we continue to push this protocol along with proper exercise, etc. Another wonderful, wonderful IV additive is reduced glutathione. And we could do a whole topic on the benefits of glutathione. So this is really the best antioxidant there is. And it's going to, because it has an extra electron, the reduced glutathione, when pushed intravenously, it is going to go scavenging for any free radicals. It's just mopping up any inflammatory markers, anything that's setting itself up. It's going to clean house. And people, again, initially don't feel great because because it's doing this work, it's almost as if your body's releasing some of that and getting rid of some of the garbage. And then, a couple days later, you're like, wow, people will call up and I don't have any joint pain anymore, Dr. C. What did you give me? Can my sister and cousin and aunt and everybody else in the neighborhood come and get this? It's really exciting. So glutathione, it's a game changer, and it can be given IM, but it's best done intravenously for these kind of, again, autoimmune, more serious inflammatory issues. I think it really could help, and I have helped many people with fibromyalgia. I think for fibromyalgia and chronic fatigue syndrome, they're very complex entities, and you almost have to have a multidisciplined approach. Last but not least, there's also, of course, IV silver, IV ozone. Ozone kills parasites and protozoans and viruses, bacteria, you name it. Ozone is very exciting. And then also IV stem cells. I think there's going to be a need and usage for people with some serious systemic disease for IV stem cell. And again, we're just kind of wanting today to start the journey, and I'm really happy that you've tuned in, and hopefully we'll carry forward and learn more to optimize people's health. Thank you very much. Have a good day.
Okay, this is going to be a cut-in that's going to take place after.
Well, I think I'll just have to do the whole exit again.
Okay, go ahead.
In terms of cost of glutathione, it is quite expensive. For each 10 cc vial, it runs anywhere between $30 and $40. So that gives you, usually it's 20 milligrams per cc, so you're getting, it's 200 milligrams per cc, so you're getting 2 grams per 10 cc vial. Usually you need 4 grams for most adults, and you can even push that dosing higher. So glutathione by itself, you're talking already an investment of approximately $60, just that. Most IVs, when they're non-glutathione IVs, run you about, including the bag cost and the tubing, about $55. So when you think about that, I charge around $150 to $185 per kind of Myers cocktail. And I think the best way to think of it is in packages. People like packages, they get a bit of a discount. So instead of it being, $550 for 3 IVs, you can say, hey, we'll do it for $500, you got 10% off. Maybe you're running another special, it's Black Friday coming up, happy Thanksgiving everybody. So you could say, we'll give you 25% off.
You don't want to do that.
Oh, okay. Sorry.
Because
Oh.
you're not
This
gonna
is for-
necessarily be,
Yeah.
I wouldn't do that if I were you.
All right. Gotcha. All right. Well, then we'll start again.
That's fine.
So in terms of glutathione, it is one of the more expensive items in the IV bag. Typically for a 10 cc vial, it runs between $30 and $40. So a 10 cc vial that's 200 milligrams per cc, that's 2 grams of glutathione. Most bags will put in 4 grams or 2 vials. So right there, your investment's about $60. If you have a non-glutathione IV, which is the Myers cocktail mentioned earlier, those run about $55 a bag, and that includes your tubing. It doesn't include nursing time, so you have to think about that. I charge for most Myers cocktails between $150 and $185 per bag. And many people in this area don't, bat an eye with that. Now, I like packages because people like a deal, and you can actually make more of a change chemically when somebody commits to 3. Usually I set packages of 3. So they say, I want to do 6 IVs. Great. We're going to, instead of it being 150 times 6, 900, we'll knock it down. You will pay for 5 and get the 6th one for free, if you will, or knock $100 off. So you can come up with creative packaging. And I think that that's smart. It locks them in, and it gets them committed, and it gets you excited about the whole program and seeing their progression. Also, on the flip side, though, the glutathione IVs, those can run upwards of $300. And again, it's because of the expense. It's because the time that you're putting in to that case, etc. So sometimes some of the cost isn't just all about nursing costs, and it's also about, you really have to study that person. Sometimes they have to call their specialist to get some other information. So that's part of it as well. I think, though, it's an exciting time. I've thought about Skyping and working with other like-minded providers, or maybe nurses that are IV infusion nurses, but that they need to get orders from an MD to work with them. So I think it's a field where it's still evolving. And it's now is the time and place to start it, and I'm excited to be on this journey with you. I hope that we'll be talking about future IV therapy lectures. Take care.